Oh, I've heard so many of you ask me to do stories on this. We've done several, but let's dive in again. Diabetes drugs continue to be in very high demand for Hoosiers trying to lose weight. We've done several stories on the short supplies of prescriptions like Ozempic, Wegovy, Mounjaro. As you likely know, the FDA now gives doctors the right to prescribe some drugs for weight loss, and we're going to dive into this a little bit more. Jasmine Gonzalvo is a clinical professor of pharmacy practice at Purdue and joins us to talk about side effects, appropriate doses, and more. And I just did say, I found myself saying prescription. Are all of those available for prescription that I just mentioned? And before we even maybe get to there, can you kind of go through all of the names of these that people are using right now to lose weight?
Sure, and it can get really confusing.
Yes.
And as a pharmacist, I try to make it as simple as possible.
Yes.
But I think the general public knows that when you have a prescription medication, there's also sort of this generic name,
Yes.
right? So I think what's gotten the most press is actually Ozempic. The generic name or the active ingredient is semaglutide. So semaglutide actually has three forms, one being a pill known as Rybelsus, then there's the lower doses of the injection, which is Ozempic, and then the higher doses of semaglutide is actually Wegovy. And this is just one medication in the class of medications called glucagon-like peptide 1 receptor agonists. So you may have also heard of dulaglutide, brand name Trulicity, also in this class of medications, or even exenatide, known as Bydureon, as the once weekly formulation.
So many people I know are taking it, are thinking about taking it. They've heard it and they're like, oh, it's FDA approved, now we're good to go. But I'm also hearing a lot of side effects. Let's talk first about the usage, because you mentioned that a little bit, and it's different whether it's the pill form or the injection. And I have been reading up on this, and some people are really questioning, well, I'm taking this dose. Well, you're taking that dose. Well, you're getting more of an effect and I'm not. So what do you say about the dosage right now, and where do you start with safety?
Right, so all of these medications really need to start at lower doses, because the lower doses allow your body to get used to the medication. If you start at higher doses, you are likely that you're going to have more side effects. So the stomach upset, nausea, vomiting, diarrhea, that would be more significant if you started at higher doses. The thing about some of the lower doses, so I'll use semaglutide and Ozempic as an example. Ozempic is really only approved, FDA approved, for the management of type 2 diabetes, up to a dose of 1 milligram per week. It's the higher doses at 1.7 and 2.4 milligrams per week that are actually FDA approved under the brand name Wegovy for the management of weight loss.
We're hearing so many people also talking about side effects. You mentioned some of them, but some so severe that they stop taking it. Others are feeling, they're having accidents, quite frankly, because of having to go to the bathroom. Others saying, I'm not having any side effects at all, and I'm losing weight, which is healthier for me. The final message for you when it comes to just knowing what you're taking, because the FDA just put out a warning yesterday and I do know people that are getting these medications from compounding pharmacies. There was a warning just put out yesterday. And should people be maybe paying more attention if they're getting it from a compounding pharmacy?
Absolutely, and that's really the case for any compounded medications, because you don't necessarily have the same regulations that you do around something that you may get in a pill, through a prescription brand name in a pharmacy. So the compounding really does need to be better regulated, and you really do want to trust your pharmacist who's compounding that medication. What else is going in there? What are the safety concerns when you start mixing some of these medications? So compounding really does come with a whole new set of things that people really need to be aware about, and may come with additional side effects, unexpected, depending on what goes in the compound.
Out of time, but is there also, I heard someone too talking about how they didn't feel like drinking at all water, and so there was a concern for some for kidney failure. Have you heard about that?
Not so much.
Okay, good.
We actually are seeing that some of these medications can actually help with the kidneys.
Oh, okay, good.
So that's actually something promising.
Okay.
That's nice with some of these medications
positive
as well.
Oh, good.
Yeah.
I'm glad you're here. I wish we had more time, because again, this is such a popular topic, but we'll continue to cover it.